Is it possible that the pace of vaccinations already is such that the rising numbers of new cases that we're seeing will not be followed with the same level of surge in hospitalizations and then following that deaths? Is it possible that there are enough high-risk people in the country who are vaccinated that even terrible amounts of transmission are not going to have the same consequence in terms of people ending up in the ER and in intensive care?
That's a really good question, and one we're looking at. You know, it could very well be, given that we have, been vaccinating our people over the age of 65. Those are the people that have accounted for 80% of the deaths so far, that we've done so well in vaccinating the, more senior members of our society that deaths might not be what we would have expected with prior surges. It's also the case, though, that, if we don't see those number of deaths, the deaths that we're going to see is among younger people. Obviously, we don't want to see those either. And there are plenty of reasons to not want to have COVID outside of just the deaths alone. We know that about 10% of the population that gets sick with COVID has long haul syndrome, has symptoms beyond 3 weeks, cardiac challenges, depression and mental health challenges, pulmonary challenges, renal failure, clotting. So there's a lot that we don't understand about this disease, and we shouldn't want to have it circulating whether or not it leads to mortality.